So let's start. Can everyone hear me? So I would like to welcome you to this fifth, I believe, webinar of this year that being hosted by the C4N Nippon Global Support Team. This is our webinar in English. And as usual, I think there are a few rules for this webinar that we all have to respect. So turn off your microphone and camera when you don't speak. Ask questions using the chat box. I think you're all familiar with that now. Identify yourself when speaking or sending a chat message. And then this webinar is being recorded. So we can move to the next one. So the topic of this morning webinar is about how to ensure quality of our Nippon analysis and Nippon product. The webinar will be organized as usual, starting with the objective, and it's our colleague from C4N Nippon, Ingo, who will present. And then we will hear from two countries' experience. The first one we hope will be Uganda, and the second will be Ethiopia. Otherwise, we will shift between the two. And Uganda, it will be our colleague Damali, and we thanks also very much the Ethiopia colleague because they have another webinar going on at the same time, actually, with which is organized at national level with IFPRI, so they had to juggle between two events. So we thank you very much for your participation and contribution. And so from the country presentation, we'll have half an hour discussion and then conclusion and potential next step. We will not be introducing all of you, but I would like to introduce two international experts that have joined us for this particular webinar. The first one is Jeff Leroy from IFPRI. Some of you know him because he's part of our expert group, the advisory expert group from the Nippon Initiative. And he has been supporting the initiative and supporting the team, especially on aspects related to data quality and analysis since the very beginning, helping with the guidance note in particular. And Jeff, if you can just say hi so that we know you are here.
Hi, good morning, everybody. Thanks for having me and thanks for the nice introduction.
Thanks to you for joining us this morning. We also have our colleague Bridget. Bridget, she's part of our extended team at C4N. She's also a data specialist, and she's working, or she's joining the Nippon effort, I will say, and she's been working with Julien on certain topics. So, Bridget, thank you very much also for being with us this morning, and I'll let you say hi to everyone so that everyone knows you. That's okay. We have hi from the chat box. Okay, Bridget is with us, but she will restart to make sure we can hear her. So from there we can move to the objective of the webinar. Ingo, the word is with you.
Yes, hi. Good morning to everybody in Europe and Africa, and good afternoon to the colleagues in Lao PDR and Bangladesh. Got my audio working, so just in time to hear you, Perrine, saying that it's my turn now. I hope I didn't miss anything important before.
Nothing.
Welcome to everybody, and also specifically thank you to the colleagues of Ethiopia who have another webinar going on at the same time. So we appreciate very much everybody's participation and that all of you are so regularly joining us. In general, of course, there are some common objectives for all of our webinars. We really would like to besides the work that you are doing in each Nippon country and with in your country teams, one of the advantages being part of a more global approach is that you can exchange experience with other countries, with colleagues in other countries, different approaches, different experience, and learn from each other. So we also would like you, again, if you today, during the discussions or during the presentations, hear something from a particular country that you find very interesting, please feel free to communicate to me, for example. If you would like to have the contact to somebody in another country, and I will be happy to facilitate bilateral communication. With regards to this particular webinar today, talking about data analysis and quality of data analysis and interpretation, we would like to discuss issues related to what is important to make sure that the quality of data is appropriate, that we can really trust the data as much as possible. How to ensure that the specific methodology for the data analysis that has been adopted is well connected, and that it is an appropriate and good methodology for it. And thirdly, once you come up with findings after the analysis of the data, so then how to interpret the results in a way that it is really well supported by the evidence, and that you can then actually with confidence go and use this to communicate, to provide advocacy to others, to policy development, to those involved in nutrition intervention planning and in programming. So these are the three main objectives specific for today's webinar. And with that said, I would like give back to Perrine or to the colleagues of Uganda then to share their country experience with us for today. So over to you.
I think if we have Dalmasi, it would be Alemayu. Alemayu, floor is yours.
Issues quality of data analysis and output, which is the experience of the Ethiopian Nippon team. Please, next slide. Yeah, we have followed three approaches. I mean, we have followed three steps in assuring the high quality and credible output. The first is in identification of the data source. After that, we have procedures followed in data management and analysis. Finally, we have procedures or methods followed in the preparation of our output, which is our reports or the briefs. This will be the methods, the steps what we were followed during our analysis and report writing. Next slide. In identification of the data source, we were followed three steps to get the best available secondary data source for our policy question. The first, consult experts from various sectors to identify the data which are the best suited for our policy question. As you know, we have through a lot in identification of the policy questions. So we list those potential policy questions and consult experts on which data set or which data source will be best suited for our policy question. This was the first step what we were followed. After that, we list all possible data sets which are identified and assessed for level of representativeness. For each data set, we are assessing the level of representativeness, methods used to assure the quality, the data quality, which is during any step of the data, maybe during data collection from the development of the tool up to the report writing, what method they were followed. After that, method used to measure or define indicator of interest, which is found in our policy question. Finally, is that possible to access the dataset? Finally, based on this list, we select the dataset for our policy question. Next, please. In identification of currently we are assessing the contribution of WASH in the reduction of stunting and diarrhea. Additionally, the overweight, obesity, and non-communicable disease in line with the nutrition. We are assessing these two policy questions. So the major data source consideration factor in identifying the data source were mainly representativeness of the data set. The data sources or the data set we have used for our analysis were EDHS, Ethiopian Demographic and Health Survey, from 2000 up to 2060, which is 4 wave of the data set. Additionally, WHO study called Non-Communicable Disease Steps Survey, which is conducted by EPHI in collaboration with WHO, which is conducted in 2060. Additionally, we have used the Household Consumption and Expenditure Survey, 2005 up to 2060, which is not mentioned here. After a process of identification of the datasets, we have selected these 3 datasets to answer our policy questions. During data management and analysis, the first steps we were followed were capacity building. For that, we arranged a training for basic experience in using the identified dataset and provide the training for the NIPN team as well as for NIPN stakeholders, which is answering policy questions using the Demographic and Health Survey data and the use of DAG or direct acyclic graph, which is a method for selecting covariates or confounders, which is a theoretical method of selecting variables. We have arranged these 2 trainings. I think there is some noise. I don't know where it comes from.
Ingo, can you mute your mic? I think it's coming from you. Thank you.
After capacity building, we were working on identifying the variable of interest, which variables are needed to answer our policy questions. To do that, for DHS, we have intensively read the DHS record manual as well as the DHS service guidance note and produce definition of each indicator what we want to study. For household consumption expenditure survey and NCD step survey, we involved in concept experts who know the data from the data owning organization. For household consumption expenditure survey, which is the data is owned by the Central Statistics Agency of Ethiopia, the NCD steps is which is conducted by the Ethiopian Public Health Institute of Ethiopia. To select variables which is not clear, we consult those experts. For the DHS have many documentations which clear the dataset, which is the record manual as well as the Type 2 DHS statistics. Additionally, we involve the data owners in the analysis process, which increase the credibility of the analysis as well as the questions arise in identifying the variable. We can easily answer those questions by involving the experts from the data owning organization. Next, please. Okay, sorry. During data management, the next step we have followed was data cleaning. In the data cleaning process, we have checked the consistency, the plausibility, the exclusion of outliers, even if for some variables may not found as what we want in the dataset, so reconstructing those variables and confirm with the reports. After defining indicators, replicate results reports from the final report. For example, for DHS, compare some of the prevalence estimates what we were calculated with the which is found in the report. For indicators which are not found in the report, we use additional sources. For example, there is a site called StatCompiler, which is owned by the DHS team. They have also many indicators in that website. By searching from that and confirm what we are doing is right. Additionally, we held a consultative meeting with experts in nutrition, non-communicable disease, experts, epidemiologists, and public health to validate the identified outcome variable and association among variables, which is one way of selecting covariates and outcomes for our future research. We do such confirmations from the experts in selection of variables. After that, use a combination of descriptive and rigorous analytical method after identifying the variables, after defining all the methods followed. After that, we have done the analysis. In our analysis, we use both the descriptive and analytical method. To make our analytical method rigorous, we have followed many steps. For example, for the analytical method, we use linear logistic regressions. Additionally, to show the effect of the covariates in the increment or decrement of the outcome variable, we use the regression decomposition analysis. To minimize bias in selection of variables, we use both statistical and theoretical method of variable selection. For statistical, we use stepwise variable selection. For the theoretical method of variable selection, we have used the directed acyclic graph DAG, which is done by the software called DAGIT. We use that to select simpler model or parsimonious model or the best model to fit our data. We use different model comparison methods. For example, for not nested models, we use AIC, African Information Criteria, BIC. For nested model, we also do the likelihood ratio test. That's what the method followed during the analysis. Next slide, please. During our analysis, we have accommodated the sampling design which is used by the datasets. For example, for DHS, we are using weights and clustering, the clustering effect of the variables, which accommodates the two-stage sampling of the dataset. To check the final analysis result, we easily understood by policymaker. To check the final analysis of our result to be easily understood by the policymaker, the result of our final analysis were reviewed by non-technical person, whether it is clear or not. After that, we have put the table and writing the report. Additionally, we have used the open data analysis process, which means we use a shared drive. Both the analysis and the policy team work from the shared folder in the drive, which facilitates review of work done and increase the accountability of the process to produce our final result. In doing this, technical support were provided by ISPRI, the NIPEN team, during all these processes. ISPRI was with us in providing also the training. Next slide, please. The final step, as we see from the above figure, the final step in the to maintain quality or credible output is during report writing and brief. In this step, extensive review process were followed. Output are reviewed by EPHI and by IFPRI team. Documentation of the review process were done to ensure that all the comments are considered adequately. Additionally, we have also used the comment matrix for each. We have developed a comment matrix for each comments done by the team will be addressed or not. If not addressed, what the reason not address that comment? There is a 3-column explanation. That's all what we have done to produce credible outcome or output. Thank you.
Okay, thank you very much, Alemayehu, for presenting your experience in Ethiopia, given all the other activities you have at the moment. We will jump straight forward to the experience in Uganda. Do you have any specific question, short questions for Alemayehu? Yes.
Good morning.
Good morning.
This is not thank you, Julian. This is not a question, but a minor correction on slide 21. The example we gave was on the training, on the capacity building. That was November 2019. We made 2016 by mistake. So just make that correction. Otherwise, I don't have any comment. Thank you, C4N, for organizing such webinar for us. Thank you. Over to you, Julian.
Okay, thank you. I just have a short question to you, Alemayehu, while we are waiting for Uganda to join. You mentioned on slide 19 that you are consulting with other key experts from various sectors to identify data sets which are best suited to answer the question, and I guess for analysis as well. How does this concretely happen? I know colleagues from West Africa, they often conduct some workshop, several days involving other experts. How do you do in Ethiopia to get the collaboration with some colleagues from various sectors?
Good morning. My name is Samuel Kipruto from Kenya. I have 2 questions. Question number 1 is that during Alemayehu has mentioned that after acquiring the data, they go ahead and do data cleaning. That is the issue of looking for outliers and other checks and excluding those ones. Now, I wanted to get from him whether once you do that from a data set like DHS, do you still have the same comparison in terms of the rates or prevalence rates that were already published? If you get the data from DHS and redo all this and remove some of the outliers, do you still end up getting the same prevalent rates? Number 2 is that the issue of capacity building. I take it that this capacity building was actually initiated by the question that was being answered. Would there be capacity building for each of the questions that will come in future? I think I can stop there meanwhile. Thank you.
Thank you. Alemayehu?
Okay, thank you. Can you hear me?
Very well.
Okay. In regarding selection of the dataset, we have a monitoring and evaluation and screening committee, which is the research wing of the National Nutrition Program. There are stakeholders which are involved there. So we ask them on what dataset will be available to answer these questions. This group are composed of different sectors, from agriculture from public health, from nutrition, and other organizations. So we display the questions and ask them which data set will best fit to these questions. So people will discuss and comment some data set or data sources. So after that, we will evaluate the data sources by the representativeness. As we can show, the quality assurance during collection of the data. Additionally, is it the data accessible or not? That were our criteria for selecting the data set. Our major criteria were representativeness. Our selected data set were nationally, regionally, and residentially representative. That's the good way for policymakers will be interested in the national and the subnational level rather than some sample place. That's why we use the representativeness as our major criteria for selecting the list of possible data sets. Regarding data cleaning, when we are doing the data cleaning for DHS, we have do our analysis based on the data, and we test our result with the DHS report, the report which is done by the Central Statistics Agency. So if there is a discrepancy between our result and the result found in the report, we have to do some clarification and read the code book. Additionally, the DHS statistics will help us to do the right thing. So we will figure it out all the things, and we don't have any discrepancy in doing that. Actually, it takes time to confirm what we have found and compare with the result in the report. But that's the way we have followed. The first thing, read the code book, how each variables were measured, for what population groups they are measured. We test, we check all these things. After that, we do the analysis and compare our result with the report. That's the way we followed. Regarding the capacity building, when we want to do one research question, we select the data set. For each policy question, we have the data set. For each data set, we select organization or expertise who have best experience in using that data set. We'll arrange a training for the NIPN and the NIPN team and other stakeholders on doing data analysis using the identified data set. The capacity building is not done for the future work, it's done for what we are working on it. For the future, when we are identifying the policy question and identify the data set, there will be another training which help us to do the writing or credible analysis regarding the future identified data set as well as the policy question. Thank you.
Yes, thank you for this answer, Alemayehu. Just to follow up a bit more, I think the question from Quenya was when you applied some data cleaning criteria and you end up with an estimate that is different from the official one. First, did it happen with your experience? And then what do you do?
Julian? Go ahead, Alex. Sorry, go ahead.
No, Mero, please.
Yeah, this is Mero from today to support what Alex discussed with our data cleaning procedures. So when we are comparing our prevalence estimates with DHS values, we compare these estimates before excluding outliers. But for our particular analysis, which are not focused on estimating prevalences, we end up excluding outliers and usually end up with a smaller sample size. So with the DHS data, the rule of thumb for us is the DHS report is always right. So if our estimates are further away from the DHS report, we have to find out why. It means like there's something wrong with our procedures. Alex, if there's something you'd like to add, over to you.
Okay, no, it's just to understand that it is a way to confirm that you are doing the right procedure, and not a way to modify, I mean, to have a different result. Okay. So now I think Damalie is Damalie, you're reconnected again. Can you? I don't know if we can hear you. Can you try to speak, to unmute your mic? Damalie.
Good morning.
Good morning.
My name is Moses. I think Damalie's network has a challenge. She's not with us, but she's trying to connect from far away. Can I run on the presentation? My name is Moses from Uganda. We work with Damalie, NIP in Uganda.
You have the floor.
Okay. We cover the UNPS Wave 7 and Wave 8 to do with data cleaning and harmonization before picking out key indicators to do with nutrition. UNPS is annually done by UBOS with over 30,000 households that are interviewed. It usually picks on key indicators to do with nutrition, poverty, education, water supply. So we pick out those estimates before the cleaning. We usually share the harmonization because we are five of us. So we usually pick out. The policy runs on a policy question that we get from OPM. That's how we go to dig into the UNPS datasets. The key policy question of this year was mainly to do with breastfeeding and infant and young child. So that's where our concentration lies. So we picked on Wave 7, which ran from 2018-2019, then the Wave 8, which we are currently working on, that is 2019-2020. And this is majorly what we looked at. Key indicators to do with child health, breastfeeding, the minimum acceptable diet, and I'm going to explain the format we go through. Before analyzing the indicators, we do the data cleaning, looking at outliers. First of all, we treasure confidentiality, so there are things we usually kick off before we actually harmonize the datasets. Something to do with interviewer names, dates of birth, for my ages of the interviewers, their phone contacts. We usually get rid of them because for the final product, you cannot have that. Then we look at the outliers to do with age. If I look at a data set if I want age between 15 to maybe 50 or 100, we usually kick off some. If you have an outlier of somebody having 1,000 years, that should get an entry error. So we usually verify from the initial people who gave us data sets. We usually have people who clean data set before we handle it to find out whether this is actual age. We usually also get rid of the duplications. Sometimes we still have so many duplicates because of the PIDs not running through the households. So that are things we really look at. Can I have somebody scroll the? Hello?
Yes.
Hello? Are you getting me?
Yeah, we.
Hello?
We're getting you. Please
Okay.
tell us when to move slide.
That's what I wanted. I wanted you to move to the next slide.
Okay.
Okay, so you told us to look at the key concepts or aspects of data quality. Our focus was the UNPS because it had most of the details we wanted. So since we are looking at child health as the key indicator, we looked at the relevance and the coverage of UNPS. UNPS is run annually, so it covers the majority of the indicators we wanted. I've explained the minimum acceptable diet, infant and young child, breastfeeding. Then we digged deep into behavioral changes. We looked at communicable diseases, most like blood pressure. We also looked at obesity, BMI. We looked at WASH indicators. So UNPS, for what we looked at, is rich and it comes from UBOS. We tried interacting with a few data sets from MDAs, like we looked at Ministry of Health. It has the District Health Information System. Yes, it is detailed, but the relevance of it, as I'm going to explain, it is too shallow. You cannot rely on it since since the representative of the dataset of the system only captures health centers that report to the Ministry of Health. Yet UNPS, the sampling is done across all the 4 regions. Usually, the last data was the 4 regions. We used East Central, we used North, East, and West. Then the accuracy. Since we do the cleaning, there are things we get rid of, as she explained, the typos, the entry errors. When it comes to the digits, we will look at the years the interview was done, and it runs from February, I think, last year to around January. It's an annual thing. Then the completeness of the data sets, since we looked at key indicators to do with child health, with the anthropometry, the child age in months, the years, it is a complete data set. We looked at other sectors, maybe energy, we looked at income levels of households. It is complete. So those are things we look at. Next slide. Then the timeliness. We look at time frame, how efficient, how effective it is. Since NIPIN addresses policies, UNPS will be the best fit for us because it's annual. You cannot influence a policy using a data set of 5 years ago. And that's majorly the challenge we had with UDHS. UDHS was last run 2016, so influencing a policy of 2020 using 2016 will be a challenge. But UNPS is annually, so it is timely, we can use that. Then the consistency, still the same. All indicators can be tracked back for the previous waves. Yes, the nutrient indicators have just been added to the previous wave of wave 7, but since it has been run for last years, we can have the same indicators, same label names being followed up, the same record manual to guide how accessible it is. The analysis unit has been set up in UBOS, so we have the datasets. We have the analysis unit of UBOS having us share the datasets. We are the first-hand users. We do the cleaning, we harmonize before running the analysis. And even after analysis has been, they do quality checks to see if it can be disseminated to the public. Comparability, this is an annual survey, so we can compare it to other datasets. Let's say UDHS, which is 2016, or we can use the same trends of UNPS. Can we compare from wave 4, 5, 7, 8? Are there changes in indicators we are looking at? If there are changes, what can be done? Next slide. Hello? Now,
yes,
the
you're
methods.
good. Continue, you're good.
The methods we use, we use Stata and Excel. We use Stata and Excel. Stata is what UBOS usually does, and before this is the approach we used. As I explained to you before we analyze or harmonize anything, we have to have a policy question from OPM. That's the policy unit of NIPIN, telling us where to concentrate more, and mostly child health, communicable diseases, breastfeeding. So before we handle any UNPS data set, we have to make sure that those indicators of key policy interests are taken care of. Then as stratified datasets are set into urban and rural. The major challenge we have with UNPS is it is stratified to the regional levels in comparison to UDHS that has until the sub-regional levels. So we stratify, we set it into survey sets, since it's a survey data set, to take care of the weighting system, to take care of the sampling units, which are the EAs. And then after setting it to Stata, to the survey set, these are the things that usually generated from the survey set, like confidence intervals to show the estimates, how close or how accurate are we. Then the coefficient of variations shows the relationship between the standard deviations and the mean. How close are they to the actual truth? These are the things we really use before we run the proportions. Then after the proportions are run, we look at the preliminary results. We usually have an analysis unit in the Directorate of Socioeconomic Surveys to look at them and see how feasible are they. Do they make sense before we disseminate them to the actual end users? The next slide. Then after they have been looked at by the analysis unit, we look at the findings. How consistent are they from the previous surveys? Let us look at breastfeeding or the minimum acceptable diet. When you look at the previous waves and this one, is it increasing? Is it decreasing? Then these findings will go back to our policy, the policy unit, to see if they are going to inform the public. Because the actual sense is, after analyzing these indicators, then what next? We have to inform the policy that at our hand. We usually take care that we look at breastfeeding, look at school feeding, if you found out that yes, children take food at school, but which type of food is it taken? Is it nutrition dense? Do they just feed for the sake of getting full, or the content is going to be acceptable? After looking at the quality of food taken, does it have an impact on child education? Do they have an improvement in grades? So the impact of analysis is to inform the policy. The policies are informed, can it have an impact on the nutrition of the children? Next status. Next slide. So this is the aggregation as I talked about. Now these are the challenges we found in the UNPS datasets. As I compared UDHS has up to 15 sub-regions categorized, but because of the small sample size of the UNPS dataset, it cannot represent the 15 regions. When you tabulate it, you will find a region having less than, let me say, 100 people. That cannot be a voice of the whole region. So our disaggregation only ends with 4 regions. Then the next one is the delayed release. We really compare accessibility, like vitamin A is very key when it comes to child immunity. These results we are being told are taken to the US. These labs in Uganda cannot give us the results. We also look at the hemoglobin results, maybe blood taken to look at the anemia levels. These are taken from laboratories outside Uganda. So these come after the datasets have been saved. So it takes time for them to meet the quality checks. I'm told it's Germany or USA that does the testing. Then there are indicators we would love to be involved in the UNPS datasets. As we have mentioned, breastfeeding, the current breastfeeding, the way it's defined, will be better for it to be improved the next time, the next wave of UNPS. Next slide. Now, apart from UNPS, because UNPS had the ideal characters of data we needed to harmonize, we had a look at the food security and nutrition assessment dataset. This was from UNICEF, but we had a lot of challenges. That's why we didn't go into analysis. And these are some of the challenges we had. The sampling procedures was not clearly clarified in the documentation. It didn't have weights, and without weights, you cannot represent. Weights help us to represent what we want. Say regions. If a dataset is not weighted, then what you speak may not be representative of actually what is on the actual ground. Then we also had a challenge with questionnaires. Some had maybe 2014, 2018, and other rounds didn't have the questionnaires. So the record manual to guide us on how the methodology was followed. Then the coverage of FSNA. FSNAs were concentrated in the Karamoja regions and the refugee camps. So as an analysis unit, we want something that is country, it's regional, that when we say stunting is in this region, it's countrywide, not only region. We want something that can represent the whole nation, not regional. We would wish that FSNA could cover, the coverage would go beyond Karamoja and the refugee camps. Karamoja is in the northeastern region of Uganda and the refugee camps. We would wish it to be expounded to other regions. Then the completeness and cleanness of datasets, the labeling. You would find variable, let me say in section A having another variable name, and when you go to another year, it has different. That distorts. We have to relabel it and rename it. You're not sure whether you're naming the actual variable. Sometimes there are changes in the variable names of the different years. Next slide. Then these are the challenges we had with MDAs. So we did a data source mapping to find out whether these ministries and the authorities had the available data we need to look at certain nutrient indicators. So we looked at ministries like health, water, we went to Ministry of Water, we went to agriculture, we went to education. Just data source mapping is all about knowing whether there are available data sets, whether we can have an agreement within ministries to have data with us so that we can analyze it. But before we get the data, we looked at key components, whether they meet it. But the challenges we had, one, as I've said, the information system. You would go to a department where most of the short surveys are funded by donors. So if a donor comes for 1 year, yes, the system will be running. But once they pull out, it is very hard. It was a challenge for the ministry to keep on running the same system that run surveys. So we need consistency when it comes to indicators. You cannot have an indicator collected for 1 year, then the next year, since the donor disappeared, we don't have it. So the system was not. Now, where the system was okay, like Minister of Health, DHIS2, it had a lot of detailed data, but when you look at the in-depth, the in-depth, like let me say community levels, you look at an indicator like somebody says somebody is anemic, but what we wanted to know, what criteria do they use to verify that this guy is anemic? Because there are so many procedures to use, and when you look at the reporting area, it is a center for. I've been to districts. A health center for may not have the capacity to declare somebody anemic because they have presented some certain signs. These take procedures. Somebody's blood has to be taken off. You have to be concrete. So those are the challenges we had. Yes, you're reporting, but how feasible is this indicator you're reporting to? The next slide. Then the other challenge of DHIS2. Amongst all MDAs, Ministry of Health had the most consistent information system. That is the District Health Information System software. For them, they report it per month. But the challenge I have with it only captures information from health centers that have accounts with Ministry of Health. In Uganda, we have private health hospitals. If I come up with a hospital that does not have the DHIS2 system, I'm going to receive patients. And since I don't have the system, the government will not capture my information. And that I cannot come up and clarify that this information is representative enough, because not everybody that has a hospital or a health center in Uganda has DHIS2 account. So with that, you only consider those health centers, mostly government, that reports. Then the other MDAs, most of the MDAs we went to, when we inquired about their reporting system, they kept on referring us to UBOS, meaning that the information system are not in place. You would go to Minister of Education, you talk about child feeding, they're like, but it's UBOS. UBOS is the main center. So most of them, I think, need an information system that's consistent. Most of them didn't have sufficient information system. Most of them had paperwork, that tracing it will be hard. Next. Then partner involvement, we have support from UNICEF. We have a senior data analysis advisor. It's called Dr. Nasu, is the one who has been making sure we are on point. He has given us key insights on how to run the analysis, on how to harmonize. We also have support from GSF. They have been supportive. They told us on how to use the input pathway and how to track activities until their actual impact. From the community level, to the activities, to the impact, and until we see a change using analysis. Thank you so much.
Thank you very much, Moses, and for taking over the presentation. And sorry, Damal, I hope you can hear us and be part of the webinar.
I can hear you.
Okay. You have some questions from Meron and Zeriun from Ethiopia.
Yes.
You mentioned that there is a large discrepancy in coverage data reported routinely through DHIS2 and from data from DHS in Ethiopia. So that's the experience of Ethiopia. There is some discrepancy in coverage. So have you come across the same issue in Uganda? And if yes, how did you go about it? So they have seen that there's discrepancy in coverage data reported from DHIS2 and DHS. Did you come across the same issue?
In Uganda?
Yes.
The discrepancies may not be that big. What my main point, Julian, was the representativeness of the data in DHIS2. Okay. Uganda has
Julian,
very many.
I can jump in if you like.
Please.
This is Nasul. So yes, I think there is also a discrepancy between DHIS2 and DHS, because DHIS2 for the HMIS, they are only concentrating, they are collecting data for those indicators that can be, collected quickly from people who come for maybe medical checkup or even treatment at the hospitals or health centers. While DHS is essentially, a population-wide, survey. So there are always discrepancies.
Okay. Meron, is that okay? Or do you want it to specify a bit more your question?
Yes, our experience in Ethiopia has been for example, for national estimate of coverage of vitamin A supplementation, DHIS would give you a national estimate, and that tends to be much higher than what is reported through population surveys. We tended to use the population surveys as better quality outputs and use the DHIS if we have to. So I was wondering if other teams have had similar experiences. Thank you, Julie.
Nasul, do you want to complete?
Yes, of course. Yeah. I mean, that's an excellent contribution. So we try as much as possible to use the population-based surveys. So DHS would be our primary sort of like data set. But given the fact that DHS is collected every 5 years, and we have an opportunity within Uganda Bureau of Statistics to use UNPS, which is done annually, despite the fact that sometimes, the data cleaning processes take longer, but then we have that advantage that we can be able to see this data year in, year out. For the HMIS, the data is only collected from those health centers where people go to report a sickness, and then the medical facilities collect those data. So those data cannot be as representative at a population level as what you'll get in the DHS. So I would imagine that you only fall back to the DIHS, HMIS data in this case when you don't have any other sort of like population-based survey data.
Okay, so you had this data available on a yearly basis through another survey instrument. Another question from Zeriun. So you explained that you have used different survey of big data sets. How do you assure harmonization and reliability of data during the data analysis process? Are you mixing up results from different surveys for the same analysis?
Hello?
Yes.
No, we cannot mix waves because they come out in different sessions. Right now, we looked at wave 7. We usually have the record dates in the data sets. We have the interview date. So before even harmonizing, what are the things to look at? Because they will ask for the date of the interview and the date completed, then the year of collection. So there's no way I can mix 2019 with 2020 because the dates and the years of collection are put in the data sets.
Yeah, maybe not mixing up as a wrong wording, maybe, but how do you compare? Do you use? Do you look at trends using data from different survey instruments?
Of course, we use that trends, but the only feasible trend we can have in UNPS is UNPS. As I explained to you, the sample size of DHS and UNPS is different. So if I compare an indicator using UDHS and UNPS, it wouldn't be feasible. The other one disaggregates still the 15 sub-regions, and it's a big. You find it having almost 15,000 observations. You cannot compare it with UNPS having 4,000 or 5,000. So the only comparison we can have is a UNPS. Maybe say wave 7 to wave 8 and wave 9. Are there changes? But comparing UNPS to DHS wouldn't be feasible to me. It would just give you an insight because the sampling frame and the sample sizes are way different.
Okay.
I can also clarify something on that, Julian. So UNPS is panel data, so you're following up the same households over time, and this started in around 2009-10. Of course, NIPIN just came in recently, and we started with the most recent waves of data. But we would be happy to go back in time and look at, to look at all those trends from that time. I think the question of mixing data sets is here coming in from the fact that Moses presented also on the FSNA data sets, food security and nutrition data sets. I mean, these are small surveys which are focused on those sort of like most vulnerable areas in the country, and that is Karamoja in the northeastern region, a typical pastoralist rugged area with very little food production and perhaps almost performing poorly on almost all indicators. And then, like about 4 or 5 years ago, it was expanded into the refugee settlements to look at the food and nutrition security of of course, children and mothers, but also taking it at the household level. So we cannot say that we will be able to compare, to put all this within the same sort of like bin and then compare the indicators from, for instance, FSNA and UNPS. But if we can have a trends analysis, for instance, for Karamoja, then you can be able to inform policy, but also inform programs on what is lacking, what progress has been done, and maybe which gaps need to be filled. For the UNPS, it will definitely be at the national level. I cannot easily say that you cannot compare UNPS and DHS. You could easily compare the indicators, but then because both of these are national population survey data sets that have weighting systems and clear statistical and data collection guidelines. So you can be able to tell that in 2016, the stunting rates was, for instance, 29.6, but then in 2016, it was 29.6, maybe 29% of stunting, but then in 2017, there was no DHS done, but there was UNPS done. Can we be able to get the stunting rates from UNPS? Yes, we can be able to do that, and then we can put a footnote somewhere that 2017, 2018, and 2019, the stunting rates being reported are from UNPS, but then for 2016 and, for instance, in the coming year, 2021, those sources will be quoted as DHS. So you can be able to compare this. Thanks.
Yes, thanks.
Yeah.
Another question. Yes, from Kifle. You have still on this different data sets that you have mentioned that you have obtained a lot of data from different sectors, different sources, but somehow you have spotted that it lacks quality and so you may have some information gap. So how do you try to improve what you have and fill the data gap to make it more comprehensive? Did you manage to improve those gaps, or you're limited?
So, Julian.
Yes.
The data source mapping we did was to inquire whether we can access data. We go to a ministry, we ask questions on how they clean the data, who's in control of it. But the answers we got, apart from Ministry of Health, were not satisfactory, because you would go to gender, then they tell you we used to run data on child education or woman emancipation. But once the project, once the donors pull out, then that is the end of the data collection. So if it's not consistent enough, then you cannot rely on it. We wanted to have an agreement with them that yes, since you're collecting it annually, can we have it? We didn't collect data from them. We were just inquiring whether they have it, and if they have it, which system do they use to ensure that it's clean, it is timely. But most of them, the information systems were still at their primary stage. They're just developing them. Majority of them had paper. Like you come and collect something on paper, it is easy for data to be lost when it comes to paper collection. So most of them are still running information systems. Most of them are still funded by donors. Most of them don't have those indicators captured. So our recommendation would be that if they have an information system that is going to be running, we would suggest such indicators to be captured. And for the consistency, the only recommendation is for the government to take over those information systems. Otherwise, the ministries may not be able to continue funding them as a ministry. It's the government to take care. As you see, Ministry of Health, it is run by Ministry of Health, but the government of Uganda backs it up.
And is there ways that NIPINs can through your capacity development plan or some small activities or direct support, can you improve a bit the system or this missing information, or centralizing data, making sure the metadata is available? Do you have some activities that can contribute to that?
The only activity I know of was capacity building of the officers. If you go, maybe you went to Ministry of maybe say water, and you found a statistician in place, could you make him appreciate the use of the data he has? could he appreciate the impact it has on a national level, that when it is quality data, it would have an influence. That is the only way we can build capacity. But for the information system, I'm not yet sure whether NIPIN has the capacity of build an information system and make sure, but we can build capacity of people at the ministries to make sure that they appreciate the role of collecting quality data.
Okay, thank you. Yes, Nasu, you wanted to complete?
Something, Julian, if you have
yes, please.
1 minute. Just go back. The data source mapping exercise was essentially stock taking exercise to see what is in existence and what we can take advantage of as the analysis at the NIPIN. Going forward, some of the analysis that we have so far been done, has been to feed into the nutrition dashboard. We have had some interactions with ministries, and one of the things that is coming out very strongly, perhaps Patrick would have a better way to talk about it than me, is that there's been calls to have sectoral-based dashboards. So if we have a dashboard for those indicators that, for instance, the Ministry of Gender is able to address, then we have it in the national dashboard, but then also we have a sectoral dashboard such that this one is very close to the Ministry of Gender, and they can be able to either maybe expand it, but also to build it, but also to see where the gaps are, and then they can fill those data gaps. So going forward, I think we'll have to do a lot of capacity building, but also we have to reach out to these interested sectors to be able to use the dashboard at the national level, but also to design for them some sort of like sectoral-based dashboard for those indicators of interest. Thank you.
Okay, so to point out which indicators are interesting and are missing at the sectoral level. I would like to give a bit the floor to Bangladesh, who would like to share their experience regarding how they have done to ensure the quality of their analysis through having a data analysis plan, which was validated by the technical committee. Is there someone from Bangladesh who would like to explain a bit more?
Hello, can you hear me?
Very well, thank you. Welcome.
I'm Tashnubha, and I would like to actually share with the practical experience, as I have get chance to analyze two data sets. One is FSNSPA and other is HIES. So from those experience, I'd like to share our procedure. Actually, when we get a policy question, then for analysis, we start our thinking how to what the policy document says about this question. We try to relate what says in the policies and what are the policy indicator relate those policy question, and then we actually go to find out the data sets. What are the available data set available? Suppose we actually prepare a matrix. Suppose in my last technical committee, what I presented, there I prepared a matrix that slide actually consists of the available data at a glance. That is, I identify 4 survey data set and which year those surveys were conducted and which organization were conducted those surveys. Then what were the sampling technique and representation of data, and what are the sample size. And representation means whether it is the district level estimation or whether we can only present the division level or only national level, this type of representation. Then also we identify the variable data related to our indicator that we identify related to policy. So then we identify our dependent variable, and also then we identify independent variable and other variables. So we try to prepare a framework, like at the left side we show the independent variable and at the middle point, what are the current intervention going on to improve those indicators, and what are the existing policies, strategies available. Then we also try to show what are the data set available, and from those data set, which data set is selected for this analysis and why, and how it will then we conduct our analysis, like primary outcome variable, secondary outcome variable, and also try to relate what are the analysis should be done there. So when we present there, then the expert, the technical committee actually, that is the national technical committee, you can say, because Bureau of Statistics produce the national official data from Bangladesh. So many of them are from the Bureau of Statistics and also from other organization. They actually produce policy. So those experts actually then give suggestion, their feedback. Actually we have to convince them that the data set we have selected, this is appropriate for the analysis of this policy question, and also we have to actually defend what method we will follow, like why we will use propensity score matching to adjusting factors to see the impact of our variable, this type of. So when this technical committee approve this data set, then we can data set and proposed analysis plan, then we can start our analysis. But it is not stop here, then we have to it is more regularly, actually weekly or bi-monthly, we have to share our progress with the in-house meeting, where also our primary stakeholder, they also join, and we also share our progress, and also what the challenges we are facing, and also then we get suggestion from them how to go forward, and also what more we need to consider. So after in-house meeting, when we can produce some primary result, preliminary findings, then we take it to the PMC project management committee, and also there we can get feedback. So this is the actually procedure in Bangladesh. We also we actually when doing this analysis, our core stakeholders are involved in this process. So when we find some challenge, problem, we share with them, and as they are actually policy makers or policy support officials, they give good suggestion actually how to go forward.
So it's a group work. It's a collaboration with other partners.
Yes.
Okay. Yeah, thank you very much for this very detailed process. Is there other questions, remark, suggestions?
Question to Uganda. In one of the slides, they have just said that the data is easily available to NIPIN. Does it mean that the data lies somewhere else for them to reach? And number two, the calculation of CIs and CVs, are they only doing for the data that is related to nutrition, or they are doing everything in the whole data set? Because I believe the data set has other variables not related to nutrition. Thank you.
Okay, thank you so much for the question. The analysis unit of NIPIN is instituted in Uganda Bureau of Statistics. So since UBOS handles data to do with panel survey, they are structured within the system, so it is easy for us to work with an analysis unit of the directorate to access the data. Then say about the confidence intervals and coefficient of variations, we set the data to survey set. When you set it, it's going to give you proportions, it's going to give you coefficient intervals, but our main interest is on numerical indicators. But all confidence intervals can be set for other indicators to do with income, to do with education, to do with energy. Once we set that into survey set, it gives you all those proportions. So we don't only set it to nutrition indicators, we set it to all data sets, but our key interest is in nutrition indicators. The data is available and accessible because we are instituted in UBOS. as analysis unit. Your boss is Uganda Bureau of Statistics.
Thank you. Thank you.
Yes.
No, I wanted to share the experience of Burkina. I had a discussion with them. They are also sitting in the statistical office, but there is a reluctance to double check on the quality of the data that is already validated, because for them it has been already officially validated. And there is no need or no appetite for double checking the quality, and also it's difficult for them in the collaboration they have with data providers, because then they are seen as a group who is going to double check on the quality of their data, and they are a bit reluctant to share their data in this kind of collaboration. So I would like to see if there are other countries who are experiencing the same or not. And we have not heard from Lao, who is not directly, the institution of the NIPIN are not directly involved with the statistical office, and maybe they have to access the data from different other institutions. So how do you make this role of a controller of data quality to make sure that the analysis you are doing is well supported by your data and the quality is good enough, while at the same time facilitating collaboration with other partners to share their data? There's someone from Lao who would like to speak around this topic?
Hello?
Yeah.
This is Anna. I haven't, I'm the policy analysis advisor, and I haven't been involved in the data collection in terms of or working with the data analysis unit as such, as I've been working remotely from Denmark, and I just came into Laos a few days ago. So I was wondering if Prosper is there, if he can add on that.
Maybe Jeff, you want to say something about this, or we have anyone?
Okay. So first of all, listening to the presentations, I got a little bit stressed because I wasn't sure there would be anything I could say about what I heard and saw in the presentations, because in terms of feedback or things that I would do differently, I thought both presentations were very strong, and they really show that a lot of thought has gone into ensuring that the process is clear, transparent, that quality is being paid attention to in every step of the way, which is amazing. So congratulations to everybody involved in this. Just 3 very quick points. The first one is in the Ethiopia presentation, I really like the open analysis process where everything is put on a shared drive or in a folder. I don't know exactly how it is organized, but I think that has 2 consequences. First of all, everybody working on the analysis has a clear incentive to be very clear and transparent, because you know that somebody is watching over your shoulder, so to speak. And secondly, it really makes it clear to the world that you're not doing any kind of obscure magic with the data, so to speak. You're very clear about what you conclude and how you reach that conclusion. So I think that's a fantastic idea and something others may want to consider as well. The second point is that, and I heard it not explicitly, but it's definitely there, that apart from all of the technical precautions we take to ensure quality, common sense is a very good strategy to use as well. do the results make sense? Are they somehow in line with what we expect to see? So I think it's there. It's just reinforcing that that is important. And then a third point is something I experienced in a collaboration with Egypt outside of this NIPN initiative. Even with the best possible precautions and strategies to ensure quality, you will from time to time find results that do not seem to make sense, and they're not due to mistakes you made or obvious data errors. I'm mentioning Egypt because they had the prevalence of stunting, if I recall correctly, was going up and down from year to year in their surveys, and nobody could really explain that. So if you encounter a situation like that, I think the best strategy is to talk to others, to talk to people outside the country, could be people inside the country, people with experience who are not necessarily closely connected to the work you're doing, but that can help you think through what the issues might be. And try to understand before you obviously start sharing these results with the outside world. So that's it. Again, let me go back to my first point. Wonderful work, and very excited to see that so much attention is being paid to the quality of what you do. I will leave it at that. Thank you, Julia.
And just before concluding, I think I don't know if other colleagues like Bridget have any additional thoughts or reaction additional to Jeff?
Yeah.
Or is that okay, Bridget?
Can you hear me now?
Yeah, we can hear you.
Great. Okay. Yes, mic problems. Yeah, no, I absolutely concur with what Jeff just said about the quality that's what's gone into to ensuring data quality. I'm relatively new to the NIPN process, so yeah, very exciting to see what everybody's doing in terms of checking quality. And I particularly liked seeing the involvement of NIPN with data owners, and sort of and it just makes me wonder how far that can go forward into influencing data owners in terms of data quality. So I mean, that's just something which sprang to mind during the two presentations. Whether that's possible or not, I mean, as Julian gave the example of Burkina Faso, that seems like quite a challenge. But it seems like in Ethiopia, maybe that and Uganda as well, it'd be interesting to see, going forward, how NIPN might influence data quality by having this communication, connection, open, sort of clarity, transparent process with the data owners. So yeah, thank you. Thanks for the presentation.
Thank you, Bridget. So on that, I will conclude actually. And yes, one long-term hope is that actually some of those findings that the team encounter while doing the data analysis and checking on data quality is actually used for kind of broader advocacy at national level, to bring some key message around, how to fill data gap, how to ensure data quality, etc., etc. So there is a kind of long-term objective or ambition that some of the output will, serve like a broader purposes and serve the ministry actually in their improving their information system indirectly. Let me just, there's been a lot of technical points that were raised, which I won't be able to summarize here. But additional to what Jeff and Bridget have said, just a couple of notes I have taken, though you will receive all of the conclusion in the note of the webinar. One was how you use your national committee to make sure that there is an external eyes and data quality is ensured and it's an open and transparent process. So that's something that I think both Ethiopia, Bangladesh and Uganda have illustrated. Maybe that's where also Burkina Faso is facing some problem. We have 1 minute left, I think. I retain also the importance of the data analysis plan, which was mentioned. Then I retain also that is there a role for NIPN in capacity building? Yes, and very much in raising awareness also around the consequences of data quality along the chain. In each raise that awareness, for people who are responsible at ministry level, and contributing to raise the capacity of those focal points in each sector. So there is a key role there for NIPN, though NIPN is more limited and it's not the role of NIPN to directly improve the information system. Then there were a lot of discussion around incentive to be open and transparent, how to engage also the different ministries and owner of the data, so that it's not it's perceived as a gain and not as a threat. And I think that's where I'm gonna leave it for now with my less expertise, with my little expertise on the subject. But as I said, I think you will receive more detail in the note we have taken. So because of time and because it's time is running, I just would like to conclude here. And again, on behalf of the team, thanks all of the contributor and participants to the webinar from the 4 countries, as well as our external experts, Jeff and Bridget, and we have another colleague actually from C4N that joined during the call, Boran. So thank you to all of you for your contribution and filling the discussion. As Ingo said, please do use as a beginning of a conversation. So if you have pickup issues or example that you are interested in having a bilateral discussion with a specific country or participant or with us, please write to Ingo, Julien, or myself, and we'll be following up and making links if necessary. On that, I would like to let you go for the rest of your journey, and thank you again for all of you.
Thank you, everybody.
Thank you. Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you.